Symbiosis College of Nursing will always strive to do the best that can be done for the patients and the families in the community, thereby coming with a tender, loving care of nursing.
A very good afternoon to all. I, Dr. Kaveri Adki, on behalf of entire team at MQR, welcome to the Emvidya Nursing Training Academy, a unique initiative in collaboration with Symbiosis University Hospital and Research Center and Symbiosis College of Nursing. The objective of this program is to train and empower nurses with knowledge on mother and child healthcare. I would like to welcome and introduce our colleagues from SUHRC and ESCON who have been instrumental in development and successful implementation of Emvidya. First and foremost, I would like to introduce Dr. Sonopant G. Joshi. Sir is director at ESCON. Sir is PhD in management from Tilak Maharashtra University, Pune, India. Sir has 2 master degrees in nursing as well as in disaster management. Sir is teaching and administration experience of total 32 years. I also welcome Ms. Prezi Varghese, Head Nursing, SUHRC. Ma'am is MSc Nursing and MBA Hospital Administration. Ma'am has 20 plus years of experience. I also welcome Mr. Imhan Ali Chauhan, Nurse Manager, SUHRC, MSc Nursing. He has vast 11 years of experience in the national and international accredited hospitals and colleges as a nurse administrator. I also welcome today's eminent speaker, Dr. Behmanta Damle sir. Sir is MD Obstetrics and Gynecology and Professor, Department of Obstetrics and Gynecology, Srimati Kashibai Navle Medical College, Pune. Sir is currently giving service at Aruna Clinic on Pune. I also welcome Ms. Archana Admute, tutor ESCON. She is MSc Nursing with 1 year of staff nurse clinical experience of liver ICU in Sahyadri Specialty Hospital, Deccan, Pune. Now I request Ms. Archana Admute to start the session. Over to you, Ms. Archana.
Postpartum period. Okay, as all of you know that what is meant by postpartum period is it is a period after birth of baby or after delivery up to 6 weeks. So it is a very important period because in this period mother can go in very much complication like postpartum hemorrhage and all those complications can occur in this period. So I am going to discuss regarding postpartum period. So postpartum period is also known as puerperium or 4th trimester. As we know, during pregnancy there are 3 trimesters, and after delivery, that postpartum period also known as 4th trimester. And during this period, there is many more changes in the physiological and physical health of mother occurs. So we have to notice the physiological and psychological need of mother. So we will see what is the definition of postpartum period or puerperium. So puerperium is the period following childbirth during which the body tissues, especially the pelvic organs, revert back approximately to the pre-pregnant state, both anatomically and physiologically. During this period, there is a changes occurs in the mother's body and it revert back toward the pre-pregnant state. So I will discuss here the stages of puerperium. So on the basis of its time duration, the stages of puerperium is first is the immediate period, next is the early puerperium and remote puerperium. In the immediate puerperium, first 24 hours has considered. Okay, and next is the early puerperium, which extend until the first week postpartum. And last third period is a remote period, which includes the period of time required for inhibition of genital organs through the 6-week postpartum. Next, in this period, postpartum period, there are many more anatomical considerations or many more anatomical changes occurs in the reproductive organ. So first we will see what all are the changes occurs in the uterus, that is involution of the uterus. So immediately following delivery, the uterus becomes firm and retract with alternate hardening and softening. The uterus measures about 20 into 12 into 7.5 per cubic millimeter in length, width, and thickness, and weighs about 1000 gram. But at the end of 6 weeks, it becomes as a 60 gram. That is the state. What is the weight of normal lady's uterus? That is 6 gram. So after 6 weeks, it becomes as a 60 gram. So what happens with the lower uterine segment? Because at the delivery, there are stretching effects occurs on the lower uterine segment. So immediately following delivery, the lower uterine segment become a thin, flabby and collapsed structure. And it takes a few weeks to reverse back to normal shape and its size. So we will see what happens with the cervix. So the cervix contracts slowly. The external os admits 2 fingers for a few days, but by the end of first week, narrows down to admit the tip of a finger only. The contour of the cervix takes longer time to regain. That is, it takes around 6 weeks, and the external os never revert back to the nulliparous state. So next we will see what all are the physiological considerations. Means what all are the physiological changes occurs in the mother's body. So the physiological process of inhalation is most marked in the body of the uterus. Changes occurs in the following components. So we will see what all are those components. So first is the muscles, then blood vessels and endometrium. So in the muscles during pregnancy, as we know, there is a hypertrophy and hyperplasia of muscle fibers occurs, and it enlarges to the extent of 10 times in the length and 5 times in the width. So during puerperium, the number of muscle fibers is not decreased, but there is a substantial reduction of the myometrial cell size. So blood vessel also simultaneously with the muscle fiber, there is a reduction and there is a thrombosis occurs with the blood vessels. So like that in the endometrium also there are changes occurs in the endometrium. The endometrium left behind varies in a thickness from 2 mm to 5 mm after delivery. The superficial part containing the degenerated decidua, blood cells and bits of fetal membrane become necrotic and is cast off in the lochia. Next, clinical assessment of inhalation. So on the basis of fundal height, we can assess how inhalation process is occurring. So on the basis of fundal height. So after the delivery, that is after the delivery, that fundal height or fundus come to at the towards the up to the umbilicus, okay, up to the level of umbilicus. So that is around 13.5 centimeters, and day by day till 9 day it become as a pelvic organ. Just a second. So we will see inhalation of other pelvic structures, how inhalation occurs. So we will see regarding vagina. The distensible vagina noticed soon after birth takes long time, that is up to 6 to 10 weeks to inhalate. So it regains its tone but never to the virginal state. Then we will see regarding lochia. This is very important to notice what is the amount and what is the color of lochia. So lochia is a simple vaginal discharge after birth of baby. So on the basis of its odor and reactions and its consistency, we can define the lochia. So firstly, we will see what is the color of lochia. So on the basis of its colors, lochia has divided into 3 stages. That is the first stage, that is lochia rubra, and the color of color of discharge is dark red in color, and it present around 4 days long. Okay. Next is the lochia serosa. The lochia serosa, that is the second stage. Lochia is a pinkish in color in the lochia serosa, and it present around 10 days long. Next is the lochia alba. It is third stage lochia, that is whitish in color. So this is regarding lochia. So I will stop here with with my presentation. Thank you, everyone.
Thank you very much, Ms. Archana, for nice introduction session. Now I will, today's session will be on topic expert opinion in comprehensive postpartum care. Now I request Dr. Hemant Damble sir to please start the session. Over to you, sir.
Good afternoon. Important aspects of this are already covered. So we will start with the next subsequent. The postpartum period already, it has been told that it is the 4th stage where the things come back to near normal or pre-pregnancy level, except for the breast, which has to function for lactation, and the involution process starts. Also, we have seen the division first 24 hours, then next week, and then the remote, which is up to the 6 weeks after the delivery. Why this period is very important. Now, this is very important slide because maternal mortality and morbidity. Mortality means death. Morbidity means, am I audible?
Sir, you are audible, but your slides are not moving, sir. I think you need to make we still see your first slide only.
So in presentation mode, so you'll have to put it
from my side, they are moving, sir.
No, but somehow, sir, we are seeing the first slide only, the topic of postpartum period. I think you should need to, sir, unshare and then share again in a full mode.
Yes, sir. It will unshare and share again, and this will get corrected.
Is it? Can you see the slides?
But sir, it still has to be in presentation mode.
So
Can you see the?
There is a small window has come. Resume the slideshow. I think you need to click there, sir. There's a small pop-up has come. Resume the slide. Now it's moving. You just need to make it to full mode, sir.
Yes.
Can you see the slide now?
It is not yet come.
Okay, anyway, I will show you with this mode only. Okay.
I think, sir, you can make a full mode, sir. There's a below button. You can just click that full mode.
Yeah, when I do it, the slides are not moving. I don't know why it is. But now, can you see the slides?
Yeah, we can see why the period is so important.
Yeah. So coming back, why this period is so important. So we are talking about mortality and morbidity. Mortality means death, morbidity means sickness. The maximum mortality and morbidity, that is the sickness and death for a mother, occurs in this period. At the time of delivery till this puerperal period. And that too maximum first within 24 hours, then within 7 days, and then 6 weeks. You can see from this bar diagram. So this period is of immense importance, not only for the mother, but also for the newborn, where stillbirths and early neonatal deaths are very common in our country as compared to advanced country. And special focus must be given for the healthcare professionals to address these issues. Now, if you see, as a health professionals, when we cater to the pregnant woman and subsequently, the intervention coverage is the least in this puerperal period. Well, it is maximum during antenatal period and then later on period, but somehow this is the period from the delivery till the next 6 weeks. Our intervention, our visits, our care is minimum. When we say that बाळ बाळंतीण सुखरूप झाली चला संपला आता. So after first 24 hours, there is hardly any attention given by the healthcare providers. And this is the period where there is a danger. In other countries and services, there are regular visits by healthcare providers at home and address their issues. This somehow is not happening in our country. So let us focus for this puerperal period and see how we can improve the maternal morbidity and mortality. Are there any still issues regarding my presentation?
No,
Okay.
sir, you can continue.
Okay. So we have seen the important physiological changes, involution. Now, here I want to focus on two important things which were not covered earlier. One is about the muscle and the pelvic floor. What happens to the tummy within the 9 months of pregnancy? It stretches. So the rectus abdominalis muscles become weak. And suddenly after delivery, it becomes flabby. Now this is very embarrassing for the woman. Same thing happens to the pelvic floor. The pelvic floor muscles get unduly stretched for about 12 to 24 hours during the parturition or period. And it is important that they get toned back to have the contents for the effective strength for pelvic floor, to prevent prolapse, to prevent urinary and stool problems. Now, these things are very, very important. The second important aspect is the weight loss. Now, how much is the weight gain during pregnancy? The attendant can write in the chat box or they can post it. So I will wait for a second. What is the average weight gain for a woman during the pregnancy? Yes. I don't know whether there is live interaction with the audience, but they can interact with each other. Now, if you see the weight loss immediately after the delivery, it is about 5 to 6 kg as a consequence of expulsion of fetus, placenta, blood. And next in subsequent days, about 2 kg. So 6 plus 2 kgs. And the average weight gain during pregnancy is more than 11 to 12 kilos. So what happens to other kilos? So each pregnancy, woman put about 4 to 5 kilos. Now, earlier this was very important when there was food scarcity, when few thousand years back there was no agriculture. The woman has to have enough bank of calories, fat to provide for the lactation where she could not move. She has to take rest. But now with the modern society, this is now more required. In fact, the women are overfed during this period of pregnancy and lactation with different kinds of high calorie food. And as a result, there is a lot of weight gain. Now, this is an important issue and the woman should target to reduce that excessively get weight over the subsequent period. And this we will see how we can do it with adequate diet, nutrition, and exercise. So this continuation of weight loss should be active by the woman to get the tone of the muscles, to get the tone of the pelvic floor, and to regain the body shape, which is very important. Now, this slide is already covered by the previous speaker. We will not go. But here you can see that about by the 10 to 12 days, uterus is hardly palpable or abdominally. So it was a distended Within 10 days, it has come. But not for these abdominal muscles, recti muscles, they become flabby because of sudden deflating of the balloon, as you say. When the balloon gets deflated, what happens? The skin, the fascia, the muscles, they all become flabby. This is already covered. Endometrium also covered. Lochia is also covered. Now we come to the general principles in the management of postpartum care. This is true for nursing. This is true for Aya, Asha, anybody who cares for the mother, also for the gynecologist and the doctors who provide the care. Number one is to restore the health of the mother. Number two, prevent the infection. Number three, take care of the baby, including promotion of exclusive breastfeeding. Next, to motivate the mother for contraception and educate mother about early warning symptoms and signs. In fact, this slide is very important and this is my principal objective of my today's talk. So we will cover in detail these points one by one. So again, if you focus and break down these key points, where it comes to the hygiene, diet, rest and exercise, breastfeeding, medications which are to be given to the pregnant nursing woman, immunization schedule, contraceptions, and educate the woman about visit schedules and warning signs. So we will break our earlier principles to these exclusive points which we will highlight today. Coming to the hygiene. Hygiene is very important. We have learned in last 2 years the importance of hygiene, frequent washing, using mask, taking adequate care and distance, clean yourself. The same principle continues here. Hygiene we break into different components. The personal hygiene, frequent washing of hands and use mask, especially when you are handling the newborn baby. Now, coming to the perineum. The perineal toilet is very, very important because after the delivery, when the lochia comes, it is a good source as a culture medium for infections to grow, aerobic, anaerobic. The natural defense mechanisms have broken down. So it is important that you clean the perineum with warm dilute solution of say Dettol or Savlon after going to toilet or after passing urine. In 1 loti of lukewarm water, you can add 1 spoon of this Dettol or Savlon and just pass it over from the pubic symphysis down, not the other way around, so that the discharge and other things get washed off. It is also important that you change pads, sanitary pads frequently and use the proper sanitary pads, not the homemades which may have problems regarding the hygiene and infection. In case you cannot purchase these sanitary pads, if they are not available, at least see that the homemade sanitary pads are well cleaned, autoclaved and thoroughly cleaned. Use them frequently, at least change it every 4 to 6 hours or if they get soaked. The next important is clean and wipe breast before and after feeding the baby. This is very important because the baby may get infected and the mother may get also infected, resulting in mastitis if the proper care of the breast is not taken. Coming to the baby, avoid bath for first at least 24 hours. In our culture, usually earlier we used to do it, but it has been proved that it is not good for the baby. There is a large temperature difference. Apart from that, it is important that the baby should be warmed in at least first 24 hours with observation of the vital signs. What you can do is you can wipe or clean with soft cloth, keep the baby warm and especially important dry. So see whether the baby has passed stool or urine and frequently change the diapers so as to keep the baby dry and warm. Coming to the care of the cord stump. Now, earlier people used to put so many powders and other things. That is not required. In fact, it is harmful. The cord can get shriveled very fast with any alcohol solution. Nowadays, we have sanitizers which contain maximum amount of alcohol. If it is not possible, then you can use alcohol containing any solution. For that matter, earlier we can have this aftershave lotion, which has also 60-70% alcohol. What alcohol does is it takes the water from the stump, it shrivels the cord and helps in falling the cord within next 4 to 5 days. So dabbing with cotton swab containing any alcohol containing solution, not with Savlon, Dettol or any soap containing solution, because that will make it moist. We don't want cord to get moist. We want it dry. So use any alcohol-based solution. Don't use any powder. It can cause granuloma. And don't handle that cord unnecessary. The next is general is for the hygiene is keep the room clean, warm and airy. Especially nowadays, restrict the visitors, and even if they come, avoid handling of baby by them. Ask them to wash hands, use sanitizer and use mask. Though these things look very simple, it is important that they are implemented properly. Those visitors who have come, it is embarrassing for household members to tell them that you clean your hand before handling the baby or don't handle the baby. But for the sake of the baby, for the sake of the mother, it is very important that you maintain some distance currently, especially in this COVID pandemic era. Coming to the diet. Now, diet is very important, especially as she is lactating. Now, the milk contains calories. So, to replenish the calories, we have to increase her calorie intake by about 500. And in that calories, especially proteins are very, very important. Now, the protein intake should be at least 1 gram per body weight plus 15 grams for the lactation or the milk which she is providing. The problem in our country especially is we have a lot of calories but less of proteins, that too first-class proteins. Now, there are many simple dietary things which are available which can increase the protein intake. For non-vegetarians, the simple solution is the egg. Egg is a very rich source of proteins and it is very cost effective. For those vegetarians, milk, shengdana, soya beans, these are one of the cheap, readily available things which give the proteins. Coming to the important thing is the rest. Adequate rest after delivery, soon after delivery is very, very important, at least first 24 hours. But at the same time, encourage ambulation as soon as possible, especially for the woman to go to the toilet to avoid deep vein thrombosis, which is very common, especially after delivery. Encourage to go to toilet to also improve the bowel and bladder function. Encourage her to empty the bladder. Now, bladder and the bowel, they have reverse reflex with the uterus. And after passing of bladder and bowel, the uterus also helps in contracting and helps in involution of the uterus. This is very, very important. Retained urine is a potential hazard for postpartum hemorrhage. So encourage the woman to pass urine frequently and ask her to go to the toilet as soon as possible. Ambulation is the single most important thing. Coming to the exercise. Now the first 7 days, patient is mostly lying on the bed. What exercise can you do? These are the simple exercises which can be done even in the lying down position. What is the aim of this exercise? To strengthen the core muscles to strengthen the abdominal muscles and strengthen the pelvic floor muscles. One should go gradually over these muscles, as especially the fascia and the muscles have become weak after delivery. In special situations such as cesarean section, one has to wait for 15 days. The simple exercise which any woman can do after first 48 hours is to walk. Walk, walk, walk. More she ambulates, more she burns the calories, more there is less risk of deep vein thrombosis. Now, these specific exercises are for the abdominal muscles, right? Resting on the bed, one can do for the prone position, lying on the abdomen with 2 pillows under the lower abdomen, rest for 20 minutes. This can be done in first 48 hours. The next is the abdominal breathing, where you keep your hands on the abdomen, lie supine, bend your legs at the knees, inhale deeply through the nose, keeping ribs as stationary as possible, allowing the abdomen to expand, exhale slowly. Now this, you are actively contracting your abdominal muscles and relaxing muscle with each inspiration and expiration. This is very important to regain the control over your own abdomen muscles. The next is the pelvic rocking, knee to abdomen. These are important for especially the rectus muscles and the pelvic floor muscles. You can take help of the physiotherapist in your department or in your unit, and you can have these exercises trained to the woman during even in the antenatal period when you conduct antenatal coaching classes. So the women are trained well before they actually go in the process of puerperia. The most important thing is you should do these exercises cautiously. Cautiously means any exercise which suddenly causes you pain or cramp, you should avoid it. Repetitions of this exercise is important rather than going for the full strength in the initial days. The same thing you can repeat 10, 15, 20 times. Okay, so as to avoid undue strain on the muscles. This is very important, chin to chest, and you should try it after 7 to 10 days after delivery, not before, where you get the tone of these abdominal muscles. Initially, you cannot make it up to this level. Slowly rise yourself, slowly rise your head, and then as you progress, you bend more forward without taking any support. So the important thing is number of repetitions should be increased and it should be done slowly. Now this lifting of the muscles, this is one very important core muscle exercises, buttock lift and leg raising. Important thing is these exercises can be done even on the bed. So consult your doctor if you have undergone any specific surgery like cesarean, but for all other women, they can do this exercise well at home. And how long it takes to do this exercise? Not more than 15 minutes, 2 times a day. So spare yourself 15 minutes. The most important here is woman is willing to do anything to regain her body shape. Where we lack is the motivation of ourselves, the healthcare providers. We do not adequately educate these patients. If we educate our women to do this, I'm sure they will do it to regain their body weight and their body shape. Next, coming to the breastfeeding. The breastfeeding is one of the most important aspects in the puerperia, and establishing adequate breastfeeding is very, very important. It should be encouraged as soon as possible and it should be exclusive. What do you mean by exclusive? No gutti, no gripe water, no honey, nothing. No even water for first 2 months. Milk has adequate water. Do not give anything. Nothing is required. No tonics. Nothing is required by the baby. Traditionally, women may give so many things like honey, guti, gripe water. These are all are proved to be more harmful than helpful. Please avoid and educate the woman, not only woman, her mother-in-law or her mother also, that how these may be harmful. This is very, very important. The next important thing is, I don't know in Symbiosis, but there are many hospitals. If you just go and visit the postnatal ward, you will see many tins of formula feed which are kept there. Especially after cesarean, first 2-3 feeds are given by. Avoid it. Your hospital should be a baby-friendly hospital. I don't think I need to tell you what is baby-friendly hospital. The nursing staff, all they should know what is a baby-friendly hospital. Those mothers who have some problem for giving milk in first few hours, there is a milk bank. I don't know whether the Symbiosis has milk bank or no, but other women can donate the milk, and rather than purchasing a whole tin, now this tin doesn't come in small pouch like 5 rupees, 10 rupees or sachets. These marketing companies, they give a whole tin of few pounds. And once you open, you cannot throw it away. You keep on giving it to the baby, and that is more harmful. So avoid purchasing any formula food for the baby in your hospital. Make your hospital baby friendly. Make milk bank. Use this facility to educate the woman. Now, I need not emphasize here the advantages of breastfeeding. The most important is it is cost effective. It has no cost. It comes free. It is readily available at correct temperature, hygienic. It is immunity boosting, and most important, it gives a better bonding between mother and baby. Now, in spite of all this, why there is hesitancy in breastfeeding? Because of lack of knowledge. First 1 or 2 or 3 days are very crucial to establish breastfeeding. And there are many taboos about the colostrum, whether to give colostrum or not. And there is hesitancy from the primary, especially whether I can able to feed my baby or not. Here comes the role of the nurses, ANM, dayas, and healthcare provider breastfeeding.
I think we have lost the connectivity with Dr. Damle, sir.
Important. Responded to 800 mail a day. We have lost connectivity.
No, now,
Hello?
Yes, got it.
now it's okay, sir. In between, we have lost. I think again we have
Yeah,
lost.
again we have lost.
I think we have lost the connectivity with Dr. Damle, sir. So let us hold on. He will join again.
Sir, just now spoke to him. He's rejoining.
Yeah, he will join again. So hold on for a second.
Yeah,
Sir is back.
he's
Yes.
Yes, sir.
there. Hemant sir, you are on mute. Please unmute yourself.
Okay now?
Yes, sir.
Okay. So these are the signs of good attachment. There are many charts which are available, which you can keep in your postnatal ward to show the different positions, how to make breastfeeding possible, what are the different options which are available, and make your hospital baby-friendly hospital. Avoid purchasing any formula feeds. That is the main important thing. Next, coming to the medications. Medications, first 7 days, patient needs pain relief and antibiotics to cover the infection. Then, important is to have iron and calcium supplementation till the patient breastfeed. This is very, very important. Usually what is done is we give the patient medication for next 7 to 10 days and patient stops. Calcium supplementation is very important in breastfeeding because mother requires about 1 to 1.5 gram of calcium per day because that calcium goes from the breast milk. What happens if you don't give adequate calcium? In the later life, mother will get osteoporosis and different complications because of bone loss. Now, before giving any other medications, especially during this COVID period, check whether these medications are baby friendly or not, because many medications pass through breast milk. So check before prescribing or giving any medication to the mother. Next is the immunization. Generally at birth in our hospitals, we give oral polio vaccines and BCG. And the next dose is scheduled from 4 to 6 weeks. Now, this is an important occasion for the mother to bring her baby to the hospital where we can care for both mother, educate her, and for the baby also. So after 4 to 6 weeks, OPV, triple, and other newer vaccines as recommended by the pediatrician is important. In those facilities where there is primary center or where the consultants are not available, mostly it is all done by the nursing staff, especially in a primary health center. So what nursing staff should do is at this point check whether the baby's weight gain is adequate or not, whether there are any other signs or symptoms which we will cover later on. And for the mother, see that she is also well, whether she is adequately feeding the baby or not, whether there is exclusive feeding or not, and ask her and encourage her for contraception and continuation of calcium and iron. Now, contraception is one of the most important aspects, especially in India where we lack spacing. We are very good at terminal methods like tubectomy or vasectomy. If you see the average age of tubectomy in our country is 25 years. Average age of tubectomy in our woman is 25 years. While average age of first birth in Western countries is 28 years. Our women, they marry fast, have 1 or 2 kids fast in succession, and they go for tubal ligation. No, this is not good for the mother. This is not good for the baby. Spacing is very, very important. And this is the right time to motivate the woman for spacing. One of the most important things in contraception is motivation, and not motivation of the mother, but motivation of us, the healthcare providers, the ayahs and sisters. The motivation, we should start it right from the antenatal care, labor, and continue in the postpartum period. And our focus should be on this long-acting reversible contraception or LARC of any choice, which give a long protection for at least 2 years to 3 years. By the government of India, it is said that the average spacing between the 2 kids should be minimum 2 to 2.5 years, when the first kid may go to the nursery or preschool, detach himself or herself from his mother, so that the baby mother can have adequate time to look after herself. Now, this is the evidence why we should counsel. This is from Bill Gates Foundation, percentage of women giving birth leaving the facility with modern contraceptive methods. before and after introduction of contraception counseling. Here you can see in different countries, before and after the counseling, there is a huge difference between acceptance of contraception by the woman. Our target should be this, that we should achieve this. Fortunately, we have a new program launched here, which we are called that postpartum IUCD, PPIUCD. I don't know whether in your hospitals they are putting. Naule Medical College, where I work, was one of the first pioneer of this PPICD, and we got the prize and memento from the government of Maharashtra and government of India for successfully implementing this postpartum IUCD program. And we are the nodal center for training healthcare providers on this postpartum IUCD program. This is one of the most cost-effective programs where you insert copper T immediately after the delivery. It is called post-placental or during cesarean or within first 48 hours. The important thing of this program is there is zero perforation. The first few problems with the IUCD like pain, bleeding are covered in the lactation, and there is great acceptability of this PPICD among the women. Currently, many of our old women, they come, and this mouth-to-mouth publicity has helped us in promoting this postpartum IUCD program in our own hospital. But there are other contraceptives also which are available. The injectable Topoprovera is another good long-acting contraception which doesn't interfere with the lactation, and it is given once in 3 months. Next, coming to the visits. What are the scheduled visits? If the delivery occurs in the hospital or if the delivery occurs outside the hospital or home, this is the schedule given by the government of India. The first visit 24 hours if the delivery is at home. This is not applicable for the hospital. The second is 48 hours or the third day. The third visit is 7th day. We have already seen why these 48 hours and 7 days are important considering the maternal mortality and mortality. And the most important visit is the 4th visit where you counsel about the immunization and contraception. So these are the scheduled visit. In case the ANM or ASHA is going to the home, they should follow these visits. In case of additional problem like low birth weight or any other problem, there can be additional visits on day 14, 21 and 28. So this is the schedule of visits which are very important. Now we come to the special situations. Just tell me before 5 minutes when I have to stop so that I will wind up the session. Okay.
Sir, we have 5 minutes more to go.
Okay, so I will wind up in 5 minutes. Okay. Yeah. So these are the special situations like postpartum collapse. Okay. Sudden collapse is a very catastrophic event and it has multiple medical as well as other components. The most important is the postpartum hemorrhage or the embolism. Now, as a healthcare provider and the nurses, they should be aware of the what to do, with which code to be applied, which equipment and drugs to be kept ready in such situations. Such trainings are important. And these are the different flow charts which has to be put in the labor room for the ready important. All maternity staff should have annual formal training. This is followed in the NHS guidelines in the UK, where at least in rotation once in a year, basic life-saving support is given and postpartum collapse training is given. And the clinical governance, that is the documentation, incident reporting is very, very important in such situation. Postpartum collapse is different than other collapse. Another special situation is puerperal pyrexia and fever. Now this is very important because woman is vulnerable for infection, especially the urinary tract and the breast infection. And this is very important. So monitoring for the fever after the delivery is very, very important, and any fever should not be taken lightly after the delivery and should be thoroughly investigated. Now, this gentleman, Dr. Ignaz Semnevilis, I don't know whether the nursing staff know, is of immense importance. And way back 200 years back, he showed that how hand washing is important before conducting the delivery. A simple intervention of hand washing reduced the incidence of puerperal fever. So there are many trophies and awards given on this name of Semnevilis. A simple intervention which was proved by him reduced the maternal mortality and morbidity by more than 50% in those days in the Europe. Mastitis. Mastitis is very common in breastfeeding women, 2 to 33%, and 10% of the women mastitis actually develop abscess which need to be drained. So adequate care of the breast. What do you mean by adequate care? Cleaning of the breast, adequate support to the breast, express the unused milk. This is very, very important. Now the last few slides, this is the warning symptoms and signs which should be trained and which should we tell the patient before going home, that in case of any fever, bleeding, giddiness or drowsiness, pain in breast, perineum laceration, any problem regarding urine or stool passing, any abnormal behavior or moods, especially. This is very important as far as psychosis is concerned. This is for the mother. For the baby, not accepting feed is the very important critical sign, and baby should be immediately bring to the notice of the healthcare provider. Yellow discoloration, drowsy all the time, breathing difficulty, rapid movement of the chest, vomiting many times, fever, convulsion, rash, pustules over the skins. All these warning signs and symptoms should be told. Umbilical discharge, and lastly, not gaining the weight. Coming to the resources. Now the internet has many good resources for the nurses, doctors, consultants, skilled birth attendants, and Government of India has produced PowerPoint presentations, manuals for this SBAs, which primarily cater in the rural population. So these are different links. This is the PowerPoint presentation by the government. This is from the WHO, and they have the whole manual and guideline on the postnatal care of women. These are the Royal College of Obstetricians and Gynecologists, UK. They have their guidelines on how to tackle these situations. And these are more resources on this. Okay. Any questions or comments?
So thank you very much, sir. You have covered very nicely to all the aspect of postpartum period and particularly the 4th trimester. So, one or two questions from my side. You nicely explained about the modification in the diet and also the exercise and how it is important for a mother who is new mother. So I just want to know, sir, how long this dietary modification and the exercise needs to be continued, sir?
As long as she is feeding.
Okay.
And we encourage her to feed the baby for at least 1 year.
Okay. Another point, sir, you mentioned that we need to start breastfeeding as early as possible once the delivery is there. But in particularly in the patients who have undergone the cesarean section, so in these patients, so when we should start the breastfeeding, sir?
Have you seen the patient of cesarean section?
Yeah, of course.
The cesarean is on the abdomen, not on the breast.
Yeah, but
so it is the duty of the healthcare provider, the relatives, to take the baby to her breast.
Okay.
Ask her to bond with the baby. Now the problem initially may be the pain which she gets in the abdomen may divert her attention little bit.
Yes.
But that pain is nothing compared to the bonding she gets with every mother is anxious to touch the newborn. Initially, there may be some discomfort or pain, but that pain is in the abdomen, not in the breast. So it is the duty of the healthcare provider or the attendant to take the baby and help her in promoting the breastfeeding. She can little turn on one side, or even in lying down position, there is something called as baby crawl. I don't know how many of you have seen those videos where the baby can crawl the abdomen and go to the breast and start sucking. This is a very natural and basic instinct. We have a hesitancy in taking the baby to the breast of the mother who have undergone cesarean. We have the hesitancy. The nature doesn't have hesitancy. You take the baby to the breast. I don't think there should be any pain in the abdomen when the mother is feeding with her breast.
Okay. So another point, sir, you explain about the mastitis and how. But what is the early signs, or how one can identify that the patient is getting the mastitis, sir?
Number one is discomfort in the breast.
Okay. Okay.
Number two, tenderness.
Okay.
Touching the breast is painful.
Okay.
Number three, rise of temperature.
Okay. Okay.
Number four, problem in breastfeeding.
Okay. Another point,
And
sir,
the important thing is the biggest enemy of breast. You know what is the biggest enemy of the breast?
what is that, sir?
Can anybody from the audience tell?
There is no direct interface, sir. Audience is in on another link, sir.
Okay, from the faculties here, it is the gravity.
Okay.
What is the biggest enemy?
Gravity.
Gravity. Adequate support to the breast, especially when they are enlarged, engorged, is very, very important. If you don't support, what happens? The ligaments which are supporting the breast, they get laxed, they get weak, and they may get weak permanently, resulting in sagging or drooping of the breast. It is not the breastfeeding which causes sagging and drooping of the breast. It is lack of support to the breast which causes sagging and support. The first important is adequate support to the breast. The second important thing is cleaning the breast properly. The third important thing is, see, the breastfeeding is there right from the birth to next 6 months. But the milk requirement of the baby is not same. So initially, some of the breast milk remains in the breast, which has to be taken out.
Okay.
If it remains, if you keep the milk in a pot for a few days, what happens? It gets soiled, it gets spoiled, it is contaminated with the bacteria. Same thing happens in the milk which is retained in the breast. Adequate care of the nipple, any sore nipple, any crack in the nipple, any breach in the epithelium of the nipple, the bacteria may go. So cleaning of the breast, wiping of the breast before and after feeding, these are very simple measures, sir, and should be done with each and every one.
Sir, last question before we close. The patients who are in lactation or those who are postpartum, do you recommend, sir, checking their hemoglobin and understanding if they required iron supplementation and all?
See, on an average, if you see, I'm talking of a specific example and a general example.
Oh.
The general example is in India, the anemia is so rampant. If you check the hemoglobin of a woman at the time of delivery, hardly 30% will have hemoglobin more than 10. So all these masses required hemoglobin supplementation during lactation also. To build up their reserves. The second important thing for those whose hemoglobin is more, one important test which we don't do frequently, which is done and which is very important, is serum ferritin levels. If the serum ferritin level is below 15, that means her stores are depleted and we have to replenish those stores. Even if her hemoglobin may be 10, 10.5 or 11, if her serum ferritin levels are low, this woman needs supplementation to replenish her iron stores. It is like keeping money in the fixed deposit so that she can use it in later rainy days.
So thank you very much, sir. It was very comprehensive and elaborative lecture. We discussed all the aspects and most importantly the practical tips. What are the practical, because which this seminar or webinar is listened and watched across the country. So not only in Pune, but across the country. So they could get a good hands-on understanding about what to do and not to do in the postpartum period. So thank you very much, sir. So we will catch up another 15 days with more topic, with one more new expert to discuss about the new aspects in the management of mother and child care. With this note, let us stop here, and I thank all the faculty, particularly Professor Damle sir, for taking us through this discussion, and also Symbiosis College of Nursing and Symbiosis University Hospital. So with this note, let us stop here. Thank you very much.
Thank you, sir.
Thank you.
Everybody appreciated about today's session as very good learning platform session. Session was very informative. Looking forward to more sessions like this. Thank you very much. Today's session was very scientific and comprehensive. I also thank all participants for joining. I extend my deep gratitude towards the eminent speaker, Dr. Damble sir, who made it very interesting. Thank you very much. It is my humble request to all participants to please fill up the feedback on RX poll. Thank you very much joining for us. Thank you.
Thank you. Hello.